Hello, everyone, and thank you so much for joining us again to listen to our podcast. We're going to be talking about inflammation again. We've touched up on that a little bit in the past. Today, I'm sitting with Dr. Nassiri, which is one of our partners at Capital Periodontal Group.
Thanks for having me. It's kind of exciting to be part of this series that you have been working on.
Absolutely.
So I'll be more than happy to do my contribution.
Absolutely.
Today.
Thank you so much. Thank you. So let's go back because, as you know, we are periodontists and we work with the mouth and the gum disease and the disease of the mouth. So this episode, we're going to be talking about a little bit about different association of the mouth to the other diseases in the body, systemic issues, other diseases. So today will be heart. And of course, the term for that is cardiovascular. So for the people to just know what that is. So tell me a little bit about what is periodontal disease? We say periodontal. What is that?
Yeah.
And
Nowadays we hear a lot about it because, most awareness among people. So periodontal disease means actually inflammation of the gum and bone.
okay.
So basically, sometimes you think about, inflammation, what is that? For example, to get started with,
Okay.
it's just our response to injury.
Okay.
Simple thing. You get sunburn. You started basically getting an infection. You cut yourself. That's the first response. Inflammation gets in there. Try to resolve it.
Okay. So basically, you're saying periodontal disease or gum disease is inflammation of the bone and the gum around our teeth. Okay. So what causes that?
So, all days we always thought about, as a periodontist even, bacteria causing the gum disease.
Okay. So when we eat, we have all this bacteria that kind of goes around our teeth, and the body doesn't like that, and that's what causes it.
But nowadays, the bacteria by itself doesn't cause actually the gum disease. The interesting part is that the inflammatory process to that causing the disease, which is basically kind of we're doing it to our body.
Okay. So it's almost like a protection. So our body's trying to protect itself. So you have all this inflammation or all this swelling and everything else that you see.
That's right.
Because of plaque and bacteria and the food debris and everything else.
And it cannot resolve it.
Okay.
So that's why ongoing process of that causing the damage to the bone and the gum.
And the gum. Okay, so inflammation, which you said it's a protective response of our body, and that's around the teeth, and you have plaque and bacteria, and that just starts the whole process. How does that destroy the bone, or what happens? Why does that do that? Because it's protection, so instead of protecting us, why is it destroying it?
So very simple process is body try to basically destroy the bacteria. If it cannot, retreats.
Okay.
How we do retreat from the bacteria? Trying to basically remove more bone so the bacteria not going to be in touch with the contact with our system.
Okay.
So
Gotcha.
basically that's a process of responding to what we call it bad bacteria that causing, toxins, endotoxin. That's how it is. But
That's how it is.
end of the day, like continuous, ongoing, we call it chronic, which means, our body cannot resolve it.
I see.
So that's what is going on. And that's why bacterial presence, inflammation, bone loss.
Okay.
So that's why they say, to treat it, you remove the bacteria, which means you don't have the bacteria, the inflammation stops.
Goes down. Okay, so very good. So it starts out as some type of a protection of our body, but then because of all the fight that's going on, the body's trying to fight this. It's almost like a war inside of our gum. Then everything gets destroyed because the body's trying to get rid of this.
And that's how when you look at other problems in the body that causing inflammation. Now, so many diseases in our body, we look at it, it was like, our body, they call overreacts, which means we have too much inflammation going.
I see.
Like RA nowadays, arthritis, rheumatoid arthritis. The body starts acting up on our own. And in this case, we don't even have the bacteria to get it started.
I see.
It's basically unwanted, uncontrolled inflammation,
Destruction. Very good. So now let's just we talked about periodontal disease. So for our listeners, they're seeing that that's actually the infection or the inflammation. It starts with the inflammation of the gum and the bone, and then it becomes an infection per se. Okay, so, and we talked about the cause. Now let's go back to talk about one of the big systemic diseases, or one of the big diseases that we have that's all over the world. It's called cardiovascular disease, which means heart disease. Tell us a little bit about that.
So what we know about heart disease is that problem with the heart disease is people get heart attack.
Okay.
One of the major cause of, death.
Yes.
What causes the heart attack? The heart attack is caused by constant inflammation in the arteries that we have, all the blood is flowing around. Then basically that inflammation causing, buildup. And that buildup either clogs up that artery.
Okay.
So basically you don't have, or those buildups detaches and start moving to the smaller arteries and stop that one.
Okay.
So that one basically don't have any blood going to your heart. You don't get oxygen.
The
That's
portion
how
of the die dies.
heart-
So,
yeah.
so literally, you're saying that of course everything in our body requires oxygen, which our bloodstream basically gets it to that organ or any cell in our body. So indirectly, so a heart is also a muscle. We know that it requires blood basically to live.
Obviously.
And by having chronic inflammation or constant inflammation for other different reasons, something happens to these plumbing or the vessels that actually feed the heart, and portion of the heart dies, and that's what's called heart attack, basically. Okay,
Completely
all right.
true.
So you said what causes. So what are the potential causes of heart disease?
So many things. One of the main things, they say cholesterol.
Okay.
So we all know that, the doctors say, okay, don't eat, fatty food, cholesterol can clog up your artery.
Okay.
They give you the cholesterol medication.
Okay.
The cholesterol medication is actually anti-inflammatory.
Yes.
That's what is basically explained by, by physicians. So it helps. It's not just that bad cholesterol we talk about. Okay, we have good cholesterol, we have bad cholesterol.
Yes.
Like a lot of HDL, we call it. We need low amount of LDL. The LDL causing, basically clogging up. So that actually causes the inflammation.
Just like regular plumbing. So if
Right.
if bad stuff goes through that, pretty much it's going to get clogged. It's going to become more narrow. So because it's narrow, the blood supply wherever it needs to go doesn't get there, basically.
Correct.
Very good. So okay, so then how can we start saying, well, the mouth causes problem with the heart? How do we correlate
Yeah,
that?
so many times we're like, think about the mouth separate part
From the
It's like,
body.
yeah, it's not basically related to the rest of the body. How that's actually it started by a physician in 80s, like it was 30 years ago. He was a physician. He had like a lot of patients with their heart attacks and started looking at them, and all of them had like bad teeth and gums, and he started following up. This started, this school of thoughts and follow-ups on the research, see what's going on, and basically a few years after they found on the studies like, okay, 1/4 of the people that have a periodontal disease, they are in risk of having a cardiovascular heart problems.
I see.
Then they're like, okay, let's take it further. Let's see. Okay, doesn't mean maybe just something else happening at the same time. They did a simple study.
Yeah, the gum study, the chewing
Yeah,
gum study. It's an
very
interesting
simple.
one.
They did the blood draw, like healthy person that doesn't have any, gum disease, or some people that have gum disease. They sit next to each other, they got their blood draw and talk and look at those bad bacteria. We call
Okay.
it like gram negative. So they're like, okay, most of them had about like 5 or 6% on their blood.
In their
you know.
bloodstream,
Yeah,
just
in their
just
bloodstream,
naturally,
naturally.
but yeah,
Yeah.
normally, yeah.
Normal. And they're like, okay, now let's chew gum. They had the gum to chew for 50 strokes.
Okay.
And then they rated that blood draw. And they're like, double checked it. The people, that never had gum disease, it was about 12%. Doubled
so gone
up.
up a little bit.
Yeah, well,
okay.
doubled up because, we live with those bacteria,
Yes, yes.
But all of a sudden, the people that had that gum disease shot up to 40%.
40%. Significant.
Significant increase. So definitely I was like, okay, that can be the relation. And they're like, okay, so that's a bacteria, bad bacteria, but is it the same bacteria? So they did more studies.
More studies.
And 7 out of 8 studies that they did, they showed that the same number and type of bacteria was in the gum disease. They found it in those buildups, plaque.
The
We
buildup
call
of
it
plaque in the heart.
atheromas. Yeah,
I see.
they saw it there. So they started, okay, maybe there's something there. And that's how, like about 10 years ago, all the, academies from, cardiology and periodontal, they came together and they talked about, okay, this is something that we need to look both ways. and start thinking about a correlation between these, and talked about we call it independent risk factor.
So our job is to let the patients know, you know what, if you have gum disease, you're also at risk of getting heart disease, and the cardiologist should be talking about the same thing, saying, hey, you know, if you have heart disease, you might want to go see your dentist and make sure you don't have any gum disease. Exactly. Does actually make it worse, basically.
That's the thing. That's nowadays, I think, most people, when they go see their doctors, if they start having a heart problem, they review actually their oral health.
Very nice.
Or, I mean, they come to us, I mean, or any of their dentists, they review their history. They're like, okay, history of, you know, problems with your heart. That put into more focus of, okay, you're in more high risk.
That's great. So this is actually has been really good, because there's not a good communication between the medical field and the dental field, because again, we thought before the mouth is completely separate from the body, but you know, they're all related in one, basically.
And more, everything comes to the hand of, you know, basically the oral health is related to the entire of the body.
That's right. Hence,
I mean, it's
the Healthy Mouth podcast.
Oh, yeah. It's a gate to your body, right?
Yes, absolutely.
Whatever you put in goes to your system, but first has to go to your teeth.
Yes. So, okay, so this is great information. So, recommendations. You know, we talked about it a little bit.
Okay.
What do you recommend?
So, a couple of things that people can do actually themselves, you know, to reduce the inflammation. I mean, so overall we talked about, okay, keep the inflammation down. That helps you with different diseases, also, you know, with your heart as well.
Yes.
How you can keep that down. They said, okay, smoking causing the inflammation in your microvasculature, which means tiny arteries.
Yes.
Then diet, very thing. Then basically,
so we had pizza right now. That was not good.
Let's see. It doesn't
Maybe
count.
A little bit.
Yeah.
It doesn't help.
Yeah, it doesn't count.
Okay, gotcha. Not tonight. It doesn't count tonight.
I know. We needed that.
Yes.
But it depends how tasty they are.
Yes.
And the problem is that usually tastier they are.
Yeah.
Probably they're not that good for you.
Exactly.
But
So
on the other hand, yeah, diet is a big part. So with tagging along with the diet is obesity is one of the main things, you know, relation between how much visceral fat you have, which means your belly fat,
Yes.
More belly fat, more inflammation your body makes. Another thing, keeping your inflammation in your mouth the lowest, so getting your teeth clean, getting your teeth checked, make sure there is no active gum disease, periodontal disease. 3 out of 4 Americans, they have it.
They have it, yes.
Exactly. So that's one thing to look into.
And of course, your family dentist will be able to evaluate that for you. And if there's any issues, they'll refer you out to get that taken care of, basically.
Exercise is great. Keeps the inflammation, you know, overall low. I mean, you might have basically, we don't talk about like the very heavy exercises, but routine exercises keep the inflammation low. Anti-inflammation, supplements of basically omega-3 fatty acids, they say amazing.
Yes.
So all of those that they are recommending on your diet and supplements, they can help as well.
Yeah, it's amazing that the protective system that we have, it's so complicated, it's so complex. And in its own way, of course, it's been destructive for our system. So there's so much that we don't know still about inflammation. And I know some of these studies that came out maybe about 20 years ago correlating the mouth to the rest of the body and other diseases, and now we get studies all the time that keep coming out. So it's fantastic that we're seeing these.
I think that's amazing because we get more. All the technology helps us.
Yes.
Because with finding the correlation and how the whole thing in our body runs with the basic inflammation system, which is the best basically defense mechanism we have.
Yes.
But
it could work against us if we're not careful.
If it goes, on overrun, then it's going to
go bad.
That
was great information, Dr. Nassiri. Really appreciate it. I think it's great for our listeners to understand that the mouth is not separate from the body, and the inflammation that we have in the mouth can actually cause other issues in the body. So it's very, very important. So to go over next inflammation and what periodontal disease again for our listeners.
Absolutely. And I think that's a main key. We don't think about our teeth and our mouth as separate basically entity of the rest of the body.
Very good. Very good.
It all functions together.
Very good. Well, thank you so much, Dr. Nassiri. It's been fantastic having you as our guest. Really appreciate it. Remember, healthy mouth, healthy body. We really appreciate you spending the time listening to our podcast.
I'm glad you're spending all this time, educating everybody.
You got it. Thank you so much.
Thank you all for listening to the Healthy Mouth podcast. As a reminder, the information we provided in this podcast is for educational and information purposes only, and it is not to substitute medical advice, diagnosis, or treatment. Please check with your family doctor or professional advisor before using any information provided in this podcast.
The Healthy Mouth podcast is co-hosted by Leo Applegate and Dr. Paul Towfighi. Our executive and technical producer is Johnny Flores, and our video producer is Aaron Zaragoza. A new episode is available every other Thursday.